A team of scientists from the World Health Organization has ended its investigation in China into the origins of the coronavirus without identifying the source. Head of mission, Peter Ben Embarek, told reporters their research suggested that it most probably jumped from bats to humans via an intermediary species. It was extremely unlikely the virus leaked from a Chinese lab. They also said there was no indication of COVID-19 in Wuhan before December 2019. The team spent several weeks inspecting sites in the city where the virus is thought to have originated. Correspondent Matthias Böllinger in Beijing has been following this story for us. Welcome, Matthias. How are these findings likely to be received?
Well, they're likely to be received very well by the Chinese government. I think it was very important for them that the WHO has, while not completely ruled out, but said that it was extremely improbable that the virus had leaked from a lab. That was something that was a theory or that the Chinese government had refuted furiously. Another finding that among the ranking of the probable causes of the virus, frozen foods are ranking quite high in the second place, and frozen foods is something that the Chinese government is drawing attention to because it might imply that the virus had been imported or had arrived in Wuhan from somewhere outside to this market and then spread at this market where the first big cluster appeared, and this is something that the Chinese government has been pushing for, although the WHO experts have said that they do not see any evidence that the virus might have come from somewhere else. They're looking into this. There have been reports about cases abroad in the fall of 2019, but there's very little data, and the WHO was careful not to support this theory.
Right. And was the team allowed the access and information it wanted?
The team has been able to visit quite a number of places, including this very disputed Institute of Virology. Of course, it's 1 year after the first outbreak, so what they were not doing is taking samples at the place, and they were not very close to the origins. They were basically asking for data and asking questions, trying to trace back the earliest cases. If theoretically they would find patient 0, then they would have maybe a clue where it really came from. But they were not expecting to find the answer in this. They were trying to put together as much evidence as possible to identify further research paths. They have said that they have succeeded in collecting a lot of material. We don't, of course, know how much of it has been pre-selected. Of course, everybody was carefully arranged in an official mission.
So, briefly, how optimistic are experts that the virus's origins will eventually be identified?
I don't think anybody would be ready to bet on anything. The thing is, if one can get back to the very early cases, probably patient 0, maybe then there would be a greater chance. But everything depends on what people might find that has happened before the virus was officially identified, before the epidemic was identified by the hospitals. So it's very hard to say, I think, how big the probability is.
Thanks for joining us, Matthias. Matthias Böllinger in Beijing.